Hello all, Dr. Alsop here, and I am very excited to discuss the nerves we need to be able to identify in this anterior neck session. Some of these nerves will derive from the cervical plexus, and some are cranial nerves, but all will have some role regarding structures in the anterior neck, so let's get started. We will start with branches from the cervical plexus, which you can see written out here. Recall that the cervical plexus is derived from the ventral primary rami, we often abbreviate that as VPRs, of spinal nerves C1 through C4. Superficial branches, which is what we are seeing here, of the cervical plexus are mostly sensory, meaning that they will send signals back to the central nervous system, either from muscle, organs, mucosa, but in this particular case, the nerves right here, these are going to send signals back from the skin. So these afferent branches from the skin are usually referred to as cutaneous nerves. These types of branches will always be cut in a dissection, so you can see kind of where they're cut here, because this had to be done when the skin was removed, so you'll always see these kind of cut in these regions. So right about here-ish, we are looking at the nerve point of the neck, and this is often referred to as Erb's point. This is a common pathway for cutaneous nerves arising from the cervical plexus. This point is typically just a little bit superior to the midpoint of your sternocleidomastoid. So you can see right here our rope-like sternocleidomastoid right here. And there will be 4 cutaneous nerve trunks that will radiate from this point of the neck. So let's get a better idea of how we're going to identify these nerves. And we will start with the lesser occipital, which I am drawing an arrow to right here. This is composed of axons from C2 and sometimes C3. I like to think of this one as kind of the one that you can see right behind the ear. So it's going to innervate the skin of the neck and the scalp posterior to the ear. Next, we're going to have the greater auricular, or the great auricular. This is going to innervate skin around the parotid gland, so this is the parotid gland right here, and we'll talk a lot about that in session 5. But it's going to innervate the skin around the parotid gland and just kind of anterior to the ear. You'll sometimes have some small branches just beneath or inferior to the ear. The transverse cervical, which is, I'm going to draw a line along with the transverse cervical, is going to innervate the skin of the anterior neck. So that's exactly what this nerve, where this nerve should be traveling. It should be traveling towards the anterior portions of the neck. And you will often see it in dissections going directly across the sternocleidomastoid. So kind of horizontal or directed a little inferiorly over the sternocleidomastoid. Lastly will be your supraclavicular nerves, and you can see a little bit right in this region. These are going to be the most expansive in terms of number of branches and territory of skin that it innervates. These nerve branches afferently innervate the skin of the neck across the clavicle, and so here's your clavicle right here, and also the skin of the shoulder, so you can have some branches spreading out towards this region as well. So those are the afferent branches. Let's move on to the efferent branch. And the efferent branch from the cervical plexus that we want to discuss has a super duper fancy name, which is the ansa cervicalis. This is a delicate loop, and I'm going to kind of draw along where it's located. A delicate loop of nerve consisting of 2 roots. Sometimes these roots are referred to as limbs. The superior root is right there. It's typically the easier one to locate. This is the one that often looks like it is sitting right on top of the carotid sheath. Now this is considerably thinner than the vagus nerve, which is located in a similar position, but it isn't visible in this image because it is deep to the common carotid, which you can see here, and the internal jugular vein. So the vagus nerve is deep in this region, so if you see a smaller nerve that is superficial, to the common carotid in the internal jugular, you are likely looking at the superior root of the ansa cervicalis. Now you can see a little bit of the inferior root back here. It is going to be deep and lateral to the internal jugular vein. And you can really see what we're talking about in regards to the loop between where the two limbs are going to meet, and you can see some of the smaller muscular branches here that are heading towards the infrahyoid muscles. So the ansa cervicalis will efferently or motor innervate all infrahyoid, aka strap muscles, except for the thyrohyoid muscle. Okay, moving away from the cervical plexus and into branches of cranial nerves. We are going to focus on a motor branch of cranial nerve 7, or the facial nerve. Specifically, we are talking about the cervical branch of the facial nerve. And this particular branch is going to innervate the platysma muscle, which you can see here, this very expansive but very, very thin muscle in the anterior neck. You can only see a very small portion of the cervical branch right here before it dives deep to innervate the platysma muscle. Most of the facial nerve branches that innervate muscles of facial expression look like they are emerging from the parotid gland. So here again is that parotid gland. You can only see a very small portion of it before it dives deep to the platysma. But since the platysma has been removed in this particular image, you can see it a little bit better here. And since platysma has been removed, it looks like it's kind of just hanging out here superficial to the sternocleidomastoid. But you can really see what we're talking about in terms of these motor branches of the facial nerve look like they're emerging from the parotid gland. So here is that cervical branch, and here is a very small portion of it with its important anatomical relationship with the platysma muscle. Okay, moving on to cranial nerve 10, which is the vagus nerve. We are going to talk about the vagus nerve so much in these first 3 sessions. It is one of those nerves that will exit the skull via the jugular foramen with its friends the glossopharyngeal and the accessory nerves, and it will be located within the carotid sheath in an intermediate and deep position between the common carotid and the internal jugular vein. And here, just for fun, you can see that ansa cervicalis that is going to be more superficial than the deeper vagus here. The superior laryngeal nerve typically branches from the vagus nerve superior to the carotid bifurcation. So this is that cranial nerve 10. This is where the superior laryngeal nerve is branching off. It has 2 main branches that we will discuss in more detail in subsequent sessions, but want to introduce them here. You will have the internal branch, which I am making an arrow at right here. The internal branch is going to accompany the superior laryngeal artery as it pierces the thyrohyoid membrane to serve the superior larynx. And so this is a completely afferent or sensory branch. The external branch, which I'm going to follow along right here, is going to serve the inferior pharyngeal constrictor and the cricothyroid muscles. So this is a motor branch, and you can see it heading towards the cricothyroid muscle here. But for now, just understand where it branches off of the vagus, so very high in comparison to the recurrent laryngeal that we'll see in subsequent sessions. And then it will have 2 main branches, the internal and the external. Lastly, let's discuss cranial nerve 11, or the accessory nerve, sometimes referred to as the spinal accessory nerve. This nerve is strictly motor and will innervate the sternocleidomastoid and the trapezius muscles. So I like to look for this nerve between those 2 muscles, so let's identify those first. So here is the reflected sternocleidomastoid and the trapezius. So you can see a nerve between the 2 here. And if you're looking over at this image, the sternocleidomastoid has not been reflected. Here is the trapezius in the back, and you can see the nerve between these two muscles here. I like, this is actually a really nice example of showing how the accessory nerve will look a bit more crinkled in appearance in comparison to other nerves. So that's something that might help identify that as well. You also can see some of the afferent branches of C2 and C3 that are going to provide the sensory innervation for sternocleidomastoid, since the accessory nerve is exclusively motor. So that completes our discussion on how to identify the nerves for the anterior neck session. Please feel free to reach out with any questions, and have an amazing day.